In our transitional housing program, case managers walk side by side with families, setting realistic goals and helping them reach those benchmarks. Thanks to a grant from Primera, client families now also have direct, easy access to a dedicated counselor as part of their transitional housing journey to stability. Many of the families we serve have experienced trauma, sometimes as a direct result of experiencing homelessness. Or perhaps it was earlier in life and it contributed to the circumstances they find themselves in now. Working through past trauma and mental health issues is a huge part of a holistic approach to healing. By making access to counseling as easy as possible and free of cost, we hope that families are able to jumpstart the healing process and perhaps start to work on the tough internal conflicts that can often derail healthy progress and stability.
Trauma has been described to me as you have glasses on, you see the world in one way, a hammer is taken to those glasses and it shatters how you see yourself and how you see the world, what you trust and what you believe. And part of the work of trauma, which a lot of the clients at Attain have experienced trauma in their experience of homelessness, it is helping them make sense of their shattered experience. I have experienced that those who have gone through homelessness struggle with isolation. They have a lack of connection. There's a lot of broken relationships with their past support systems, with family, with those who have been close to them. Many of the individuals that we work with have been through domestic violence. Their boundaries and their sense of self has been violated. So they're asking questions of, how do I trust myself again? How do I trust other people? So the counseling program at Attain lowers barriers to these clients receiving mental health resources, which is so important for their well-being and for their success after they leave Attain. By the case managers making a referral, I am able to easily contact these clients and set up an appointment the day of, that week, or the next week, whenever it works for them. There's often an established sense of trust because they trust the case manager, and so because of that, they trust me and they want to meet with a mental health professional. In the counseling program at Attain, I'm able to give populations who are underserved, who wouldn't necessarily have access to quality mental health care. And these individuals have experienced so much suffering, they absolutely deserve the highest quality, most consistent mental health resources. And this program is able to give that to them. To understand the process from crisis to transition to stability, it can be helpful to understand the brain. When we've been through trauma, an analogy is our lid is flipped, and the thinking brain that's responsible for long-term thinking and decision-making is often not engaged. And the emotion brain that can be flooded with cortisol, that is constantly trying to scan the environment and potentially see if there's any triggers or any threats or any dangers, that's often based in the client's story of trauma and struggle, is constantly on. I've seen clients make many steps forward in their healing journey at Attain. A lot of it is understanding their story, understanding their narrative, replacing some of the maladaptive beliefs that they have about themselves and the world, understanding their triggers, understanding that their past is no longer their present. In the experience of homelessness, in trauma, parents are so focused on daily surviving. When they come to the transitional program at Attain, they have this new opportunity to know their child in a place of stability and to relate to their child in a place of stability. So they're asking these questions, what does that look like? So we set up daily check-ins with the kids and the parent, a routine time where the child knows at dinner, my mom is always going to ask me, what is one comfortable emotion today? What is one uncomfortable emotion that you felt today? And as trauma triggers arise, which sometimes they can arise even more in places of stability and transition, we equip the parents to be able to regulate themselves, to then be able to regulate their child, or to be able to have a safe place with tools for their child to process through their experience and heal. Inherent in the experience of the pandemic is a lot of us have experienced isolation. loss of opportunity, loss of experience, a sense of unknownness, anxiety, not knowing what the future holds, missing important events in our life. This can give us empathy for those who've experienced homelessness because they have lived with many of these experiences to an increased degree. And while some of us perhaps have had an abundance of resources and social networking or social connections to help us cope and get through these difficult experiences, those experiencing homelessness are navigating the stressors of the pandemic in isolation without a support network. In the support group, I love to sit back and I love to see clients who have been so isolated, who have been so fearful of sharing and engaging with others because of their experience of isolation and their trauma, start to light up. You see within them, oh, I feel known, I feel loved, I feel celebrated, I feel like someone is here to support me. And when they start to engage and talk more together, I feel so hopeful for the connections that they can have, for their families, for their futures.